Football is one of the most popular sports in our nation. High school players strive to play at the Division I level. Fans watch their favorite team every Saturday. I've been fortunate enough to play for 4 years. But however, we have to ask ourselves, what is the damage that's being done to the players? Football is a very violent game, and it always will be. It's a great game, but once again, it hurts players a lot. What is the damage? What's the long-term damage? What are the effects of football on an athlete's body? That's what my study is designed for. The participants for the study would be 5 randomly selected freshmen, and the process would begin when they first arrive on campus. They would be administered questionnaires, MRIs, X-rays, and CAT scans to see what their past medical history is. The screening would also continue, and their injuries would be tracked throughout their entire career. 2 times a year, in June and also in January, screening would be done again. Once again, X-rays, MRIs, CAT scans, questionnaires, and interviews will be done to see how injuries are affecting our athletes. Concussions are a very serious injury. They're never going to leave our sport unless we stop making tackles and take helmets off. However, we must be aware that concussions are happening and must try to prevent them as much as possible. A serious side effect of concussions and repeated concussions is CTE. CTE is a disease that can lead to memory loss and depression. CTE has been found in ex-football players that have died at a fairly young age. Just recently, they have found the signs of CTE in living ex-football players. With this happening, hopefully our knowledge about CTE will improve and we'll be able to prevent it better. Another serious injury is tearing of the ACL. ACL is a ligament in your knee, and often happens when someone is falling on wrong, plants wrong, or jumps wrong. It's a very serious injury that almost always results in surgery. The surgery sidelines a player for about 6 months usually. It can happen when ligaments and tendons aren't strong enough in the knee, or sometimes it's just a freak accident that is unavoidable. Once again, college football at the Division I level is a great game and a very popular game. It's violent and it causes damage to our athlete's body. It's time that we find out what exactly that damage is so that we can inform our athletes and the players what they're getting themselves into and how it will affect them for the rest of their lives.